It's been really fascinating to look at the gut zoomer test because it gives us so many different places to focus. I used to do parasite testing that found really high rates of parasites, and then that company went out of business. It was like an old school company with a old gentleman that would look under a microscope, right, and look at poop all day.
And send you reports on paper.
Yep. And so they were able to find really high rates of various infections.
Yeah.
And then went out of business. So then I started working with other gut tests. And then I just was like, oh, does nobody have infections anymore?
All went away.
They all went away. Nobody was testing positive. So to give you an example, the blasto rates were 29% with this old school test in my client population. And all of a sudden we went down to 8%.
Wow.
With different methodologies of testing.
Yeah.
And I just was like, okay, what's going on here? And so I started doing tests on initially my family to see.
You would like double, triple test people, right?
Exactly. Yeah. So you take like one poop and then you put it in different kits. And all of a sudden the gut zoomer, we're finding infections and we're treating the infection and eczema's going away.
Wow.
We're, really seeing that this test comes up positive for infections when other tests don't.
Yeah.
And so it was a little bit intimidating at first. At first I was just like, I just want to look at the infections, right?
Right.
But once I started to learn how to use it, elastase levels. So these are going to be really helpful if somebody has pancreatic insufficiency and they might benefit from pancreatic enzymes. This oftentimes shows up as diarrhea or intolerance to fatty foods.
Right.
So that can be a really helpful marker. The intestinal permeability markers, whenever I see those, then I'm thinking about, okay, what can we do to repair the gut barrier?
Yeah. Then
also the calprotectin marker, whenever that's elevated, we're going to be thinking about how do we reduce inflammation?
Right.
Calprotectin can be elevated in inflammatory bowel disease. It can be elevated in food sensitivities. Doing an anti-inflammatory protocol is generally going to help. So I love using things like Boswellia, serum-based immunoglobulin for people that have that elevation, right? So it really allows me to tailor the plan for the person rather than being like, you have IBS, eat more fiber, right?